Friday, everybody. Dr. Amy Ostick here at Health and Healing Direct Primary Care in Woodland Hills, California, flying solo today. Dr. Brian's in the ER, doing morning shift today. And I hope you all are staying safe. We are. We're all out of our isolation and quarantine periods. We were fared very well through COVID, and we're very grateful for that. I thought it would be a nice thing today to review something that I've been educating a lot of patients about, a lot of schools about, is just how safe is it to reopen schools? What's the data behind reopening schools? Since a lot of countries across the world have done it safely, and we see a lot of headlines about specifically New York City now closing down schools for the indefinite time period as a reaction to the increased community spread and their numbers. Here in LA County, we had 5,000 cases yesterday, which is the highest we've had daily case rate, or number, I should say, really since July. We were in the 4,000s in July. Our mortality rate is staying pretty low. Our hospitalization rate is going up a little bit. We are getting better at treating this disease, certainly. But none of us want to be on this side of the statistic of doing poorly with this disease, and it's not something that we're trying to get or give specifically. But I wanted to talk about, and Dr. Fauci said over and over and over, the two things that are working are masking and social distancing. If we can continue to do that, what you're doing innately is assuming that everybody around you is positive. And by masking and social distancing, you're reducing your risk of transmitting, receiving, or giving that virus by at least 80%. So what about schools? Are they a big source of transmission here as we're opening up waiver programs in LA County? A lot of schools, over 60 schools, received the K-2 waiver. Some schools are adding to third grade. Is that a big source of surging cases? And they haven't been. Across the world, we can really point to schools as being reflective of what is going on in the community, but not as a major source of transmission. And even there may be some literature. There was a recent study looking at the New York City School District specifically, that it actually may be even protective. I can tell you from personal experience, the measures that are being taken at our local school and from a lot of the schools in this area as a part of this waiver program are very strict and regimented with regard to universal masking, with regard to staggering drop-off and pickup, with regard to distancing and plexiglass barriers, and how these kids are cohorted, surveillance testing the teachers. In a very regimented, strict way. New York City tested over 74,000 of their staff and kids during a 3-week period of over 1,200 schools. They showed 45 students, 63 staff of those 74,000 students and staff came back positive in that time period over a 3-week period in October. 40 times less what was going on in terms of their local population, their community. So in some ways, having a regimented in-person school program can maybe be protective. Other than, if you think about it, parents have to do something. Parents are shoving their kids maybe into pods that aren't as regulated or as controlled. Maybe they're going to daycare settings. Maybe they're going to local Ys that don't have the resources to do the social distancing or follow protocols as well as they could. And increasing that risk of exposure and transmission, whereas schools have the capability to enable to have the staff and the resources to practice that physical distancing and all the measures with regard to masking, temperature screening, and all that. It works to protect our teachers. And there's even literature to support. The CDC recommends 6 feet between desks or physical distancing with students. The WHO recommends a meter, which is a little over 3 feet. And so it does create a problem when you talk about if you do 6 feet, you can only have so many kids fill up a classroom. But if we did, there are lots of countries that practice the WHO guidelines, which is 3 feet, and have not seen a big surge or major transmission or source from schools by practicing that. So a lot of literature, a lot of good evidence, real-time evidence showing that schools are not a major source of transmission. That kids don't spread this virus very efficiently laterally amongst each other or even vertically up to teachers. It's still not a zero risk, and nothing is a zero risk. But what we do know that is very risky, remote and online learning. Our kids are really bearing the brunt of this pandemic in terms of not just academic, but social and emotional consequences from remote and online learning. The economic consequences from that, from parents having to stay home and carry that burden as opposed to going to, working. And that is what we need to start thinking about is how our schools function not just as an academic institution, but as meal replacement programs, as physical education centers, as mental health access points for kids. Unfortunately, the biggest burden, the biggest fallout will be in our populations that already have problems with accessing good education. And maybe some of these kids, there are some studies looking at when schools go remote or online during big natural disasters like Hurricane Katrina or Maria. 1 out of 5 kids in certain regions won't return to school. So what does that look like? What are the long-term consequences of forcing our kids to stay remote and online when the science doesn't support it? We need to follow the science and not be reactive and emotional to to what political pressures or institutions out there are telling us to do. We need to be mindful and follow the science. Every other country is doing that. I'm very much in support of that. I know everybody should at least be given that choice. And I know it's a difficult one. Everybody's situation is different. And maybe you have at-risk parents at home, and maybe that doesn't feel or sit right with you, and that's okay. But it's a complicated issue. I hope we can get all back to school soon in a safe way that's regulated. I am so proud of our community locally for doing everything they can to keep our kids back in school and safe, keeping the faculty and staff safe as best we can. Take care of yourselves this holiday. Keep it as safe as possible. Whatever that looks like, it's going to be different, but just enjoy each other. And we're here for you if you need us. www.healthandhealingdpc.com. Dr. Amy Ostick here. Have a beautiful holiday.